Welcome back. I want to share with you the importance of a vital nutrient, a vital part of our diet that we don't often think about. And I want to start by sharing the impact of this nutrient because an experience I had when I was working in one of the university hospitals in the pediatric ward. There was a mother who came in with her baby, and the baby was irritable, just like in her arms, less than a year old, but crying, and just an unhappy baby. It didn't smile. It didn't like to be held. It didn't like to be put down. It was just constantly crying. It was the definition of baby colic. Now, the baby also had a rash on its scalp, and this rash was kind of this scabby, peeling rash. So the mother and the baby had been into the ER. This was their third time. And each time she brought the baby in, the team would treat the baby with IV antibiotics because they thought it was a skin infection, which it likely was. There was a skin infection, but the upstream cause was not identified. And that's kind of the key in medicine, I think, is really getting to what the upstream cause is for symptoms. So the mother ends up staying overnight in the hospital with the baby. And one of the residents walks by and looks at the baby and looks at the baby's personality and says to me, because I was just a medical student at the time, kind of learning, she said to me, put this order in, put an order in for zinc. And I said, okay. And she said, the attending doesn't believe that a baby in the Western country, in a Western country, could have a zinc deficiency because it would be impossible. They're eating a good diet, they're having good milk, everything should be fine in their diet. But she said, but I want you to go ahead and sneak that order in because the attending physician, who's the physician basically overseeing the case, they're the one in charge. And the residents and this medical students were kind of like the people below. We're just following instructions. And so her suggestion was kind of unheard by the attending. He sort of said, that's not possible. Don't even bother putting that order in. So we put the order in, and the baby's zinc level comes back so low that the lab calls us on the floor, the medical floor, to report that this zinc level is one of the lowest they've seen and this needs to be taken care of right away. So we get the report back, and the resident starts the baby on zinc within hours because, again, I'd been staying, sleeping, working in the hospital for weeks now at a time. The baby is smiling, cooing, laughing, and you can just see this change. Now, over the next day or so, the rash also starts to recede. But what was more striking to me was the baby's personality really changed once the zinc was started. Now, you might be asking yourself, well, is this something that's in the practice of medicine? How do I find out about this? There is actually a protocol that many physicians are looking into. It's more in the world of psychology and psychiatry. So this realm of specialty is familiar with a protocol called the Dr. Bill Walsh Protocol. And that protocol looks at nutrients as well as how deficiency in nutrients and maybe even an overabundance of certain nutrients can affect the brain health, can affect brain inflammation. So we can see in the case of that infant, likely this infant was having brain inflammation from such a lack of zinc. And once that zinc was started, he immediately felt better. He felt happy. So it's kind of one of those things that we ought to be considering maybe even before we start looking at drugs, is what's the nutrient balance in the body? And there is a way to test that, and that's all in the Walsh Protocol. So I want you to know that that is another alternative. It's considered an alternative therapy. It's not considered conventional medicine. So it's probably more in the realm of alternative or lifestyle medicine. But I put the link down below in case you wanted to explore that. I wanted to share that story with you because it's one of the striking examples for me of how I began to understand that looking at vitamins and nutrients is one of the basic things to do when we're looking at the health of people and when we're looking at trying to optimize the health of a person. Thanks for joining me.